Okay, we're continuing with Unit 6, Pharmacology, Chapter 9. We started talking about viral infections. They're very common. Some are life-threatening. Some require no treatment. Others can cause serious damage or death. Hepatitis. Viruses are intracellular, submicroscopic parasites that must infect a living host to reproduce. And a host is the person infected by the virus. And there's two types: common viruses or non-retroviruses and retroviruses. Two categories of antiviral drugs and antiretrovirals. An important concept to remember for all antiviral drugs is that they are only virtuestic. That means that drugs reduce the number of viruses by preventing them from reproducing and growing. They are not virucidal and cannot kill the virus. They just keep them from reproducing and growing. By keeping the number of viruses low, antiviral drugs allow the natural defense of the body to destroy, eliminate, or inactivate them. So they don't kill the virus like the bacteria do. They just prevent them from reproducing and growing. And antiviral drugs are virtuestic, and that prevents viruses from either reproducing or from releasing their genetic material. Before administering any meds, you check for allergies. After the first dose, check every 15 minutes. For allergic reaction, monitor the site. Take all the meds as prescribed and take them evenly throughout the day. These meds are used to reduce illness duration by controlling the viral reproduction. The med forms counterfeit DNA bases and inhibits the enzymes needed to complete the formation of viral DNA. So we try to confuse them by creating a counterfeit DNA base, and then the virus can't complete that complete DNA chain. They're utilized for herpes, varicella, Epstein-Barr, mononucleosis, West Nile, RSV. The meds we use are Zovirax, Valtrex, and then the influenza, Tamiflu, etc. This med is an oral drug that acts as a counterfeit base, limiting the DNA replication and reproduction of the hepatitis B virus. These actions suppress the viral replication in infected cells, especially the liver. For hepatitis, the duration can be months or years that you have to take the med. Side effects, adverse effects, interaction, and they carry a black box warning. You need to review that in Chapter 1. These drugs they prevent viral infections by blocking the external coating of the influenza A virus, stopping the release of viral particles into the respiratory cells. Remdesivir tends to concentrate more in the respiratory tissues and less in the brain than amantadine. Thus, it has fewer nervous system side effects. Amantadine has anticholinergic effects and hallucinations, as well as orthostatic hypotension. Big time side effects, adverse effects on that. Ribavirin is a counterfeit base that suppresses viral action and reproduction by unknown reasons. It is effective in suppressing many viruses. However, because of its severe side effects and adverse effects, it's most commonly used for viral infections that do not respond to any other antiviral agents. Tetragen, it's an agent that causes birth defects, so it is tetragenic. Suppresses bone marrow, can impair your liver, heart, kidney, ears, cancer. I mean, it's big time bad. Zanzimir and oseltamivir work by inhibiting the enzyme neuraminidase, which is needed to spread viral particles in the respiratory tract. Retroviral infection. Retrovirus is a special type of virus that always uses RNA as its genetic material and carries with it enzymes reverse transcriptase, integrase, and proteinase, which allow high efficiency of cellular infection. This means that the disease may result even when low levels of retroviruses enter the body. The HIV is a retrovirus that attacks the immune system. The most severe form of HIV is AIDS. So retroviral is that type of infection. Opportunistic infections are caused by organisms that are present as part of the normal environment and kept in check by normal immune function. In persons with AIDS, the immune system is extremely suppressed. Remember T cells? We talked about T cells and helper cells. T cell count falls, viral load rises, and without treatment, the patient can die from an opportunistic infection, and usually it's pneumonia if it's an AIDS patient. Antiretroviral drugs are a broad category that suppress the reproduction of retroviruses, which use RNA as their primary genetic material instead of DNA. And that's what we're dealing with now with this coronavirus. 6 classes of antiretroviral drugs: nucleoside analog reverse transcriptase inhibitors, or NRTIs, non-nucleoside analog reverse transcriptor, or NRTIs, NRTIs, and NRTIs, nucleoside and non-nucleoside, protease inhibitors, integrase inhibitors, fusion inhibitors, and entry inhibitors. Patients with HIV receive drugs from several classes in regimens called cocktails. So they get a cocktail. Because HIV is not controlled by one drug alone, the approach is termed as highly active antiretroviral therapy, or HAART, H-A-A-R-T, and that's when they take several classes of antiviral drugs and mix them together and give them a cocktail. That's HAART therapy. These drugs are virtuistic and do not kill the virus. Now some HAART drugs are becoming drug-resistant mutations, so again, we've given them so much that they're mutating and not effective. Factors contributing to this are missed drug doses, causing blood concentrations to lower, allowing the virus to replicate, and they can cause liver toxicity and hyperglycemia problems. Early treatment of antiretrovirals can get a delayed onset of symptoms, delayed development of AIDS, blocks the replication, and here's the things you need to watch for. You need to watch for the viral suppression of the ability to reproduce. The viral load is what they're looking at, the number of viral particles in a blood sample. Immune function, and remind the patient that these drugs do not kill the virus or cure the disease. They only help reduce the number of viruses in the body. The person will still have HIV. Types of antiretroviral drugs are, I told you about the NRTIs, and that's Zygon, Videx, Intrevia. The NNRTIs, Rescriptors, Sustivia, and Intellence. This is interesting. Tell them not to take St. John wort because it decreases the effectiveness. Protease inhibitors. They prevent the replication and prevent the release of the HIV particles from infected cells. HIV produces its proteins. To be active, this large protein must be broken down into separate smaller proteins, and that would inhibit that. PI drugs end in Navir. Side effects. Integrase inhibitors are usually prescribed for people who have HIV. Fusion inhibitors is another class. entry inhibitors. Chapter 10, let me look at 9 here real quick. You need to know what an antiviral drug is and what does it do. They do not kill the virus, they only suppress the reproduction and growth. You need to know the categories, the adverse effects of amanitin and rimidacine on page 143. They can affect the central nervous system. That's an adverse effect. You don't need to know all of those drugs. You need to know the categories. I told you about the St. John wort. Make sure you know that. Protease inhibitors are a class that prevent HIV replication and prevent the release of HIV particles from infected cells. We talked about that. The generic names for protease inhibitors usually have Navir at the end of their name. If patients are taking statin drugs, they can have problems with muscles, and you know statin drugs causes muscle cramps anyway, so this can increase those problems. Truvada in a combination with other drugs are used now for sexually transmitted diseases. So they have some new drugs on the horizon for pre-exposure prophylaxis, and one is Truvada. You need to know that. Okay, know the key points in Chapter 9. Chapter 10, we're talking about anti-infectives, anti-tubular, antifungal drugs. Tuberculosis is the most highly communicable disease caused by Mycobacterium tuberculosis, and it's spread by aerosol transmission, which transfers the droplets through the air with a person who has active TB, and they may be inhaled by others, just like we're going through now with COVID. The bacteria forms a primary TB lesion in the lungs. That's lungs. The lesion is surrounded by more white blood cells that cause a response known as pneumonitis. So inflammation of the lungs. Anti-tubular drugs. Tuberculosis is a disease still found among the poor and undernourished. Requires reporting still to the health department. Most treatment is done through the health department and the CDC. Isoniazid is the one drug that I've heard it's the only drug used for prophylactic therapy, and it's taken for about a year. So if you are exposed to TB and you come back TB positive, you'll probably be put on that for a year. Cough, pain, fever, night sweats, and weight loss are the symptoms. And you must monitor liver functions if you're taking, it's called INH. And this drug can cause hepatitis, so you're trying to get rid of TB and you might get hepatitis. So it's a drug you've got to stay up with your patient and or you. These first-line drugs are INH, rifampin, PZA, EMB. So we want their cough to be reduced, sputum production reduced, fatigue is better, weight is gained, sputum culture is negative. Side effects, the drug can stain the skin, sensitivity to sun and gout, and remember liver toxicity. Patients must take the medicine 6 months or longer. Avoid alcohol and Tylenol. Notify the MD if the skin becomes yellow. Why is that? Because they're getting jaundice from their liver. Teach diabetics to monitor their blood sugars always. INH can raise blood pressure, so avoid caffeine. Rifampin can stain the skin, urine, and all other secretions. Drink 8 ounces of water and to increase at least 3 liters of water daily. Watch the sun. Notify the MD of vision changes. Fungal infections is a simple organism with 1 or more cells that reproduce by spores. So fungus is a spore. It has walled cells and can either live peacefully with humans or infect and cause disease. They have a thick, tough cell wall and a plasma membrane that is made of materials different from bacterial cell walls. They live in moist, dark places. Candida are part of the normal flora that do not cause problems unless they overgrow or enter the body. It's like I have some typos. Mycotic infections are fungal infections. They're systemic infections that can affect internal organs and can be fatal. Superficial infections, mycotic infections, are nail, mucosa, skin, ringworm, athlete's foot, perineal rash, etc. Patients that are at high risk, of course, are diabetics, pregnant, incontinent, or on antibiotics. Yeast like warm, wet, dark areas, and they feed off of sugar. That's why you see athlete's foot, jock itch, perineal rash, rash under the skin folds, vaginitis, thrush. So they like that warm, dark areas. So a morbidly obese diabetic client is ideal for a yeast infection. Be sure all skin folds are dry and cleaned regularly. Hygiene for the obese patients are under skin folds and the abdominal fold. Here's the antifungal drugs. Systemic infections, they get amphotericin B by IV, very strong, causes phlebitis at the IV site, severe swelling and redness. Be really careful with that one. Diflucan or fluticasone, catecholazone, those are used for systemic. Superficial fungal infections under the skin, nails, mucous membranes, those are monostat is the one I usually hear about. Tinactin, heard about that. That's usually for the foot. Common ones. Avoid food or drink 30 minutes after oral administration. Lie down after vaginal administration. Take after other oral meds. Report skin irritation. Must watch the liver function test. Okay, I'm going to stop at chapter 11 and we'll pick it up in another video.